everybody. Welcome to the County Seat. I'm your host, Chad Booth. Today, we are talking about Medicaid expansion. This has been a topic really over the last almost decade since the Affordable Care Act came into play and the need for Medicaid expansion. Utah has drawn up to the idea of finding a way to, or a different way to expand Medicaid coverage, trying to be fiscally responsible. However, the conversation has taken on new light because of the problems we've had with homeless, opioid addiction, the problem around Rio Grande, and it's become very important. So we're going to pick up that conversation today and talk about Medicaid expansion with perhaps Utah's best expert on it, Dr. Brian Shiozawa, who's a Utah State Senator. Thank you for joining us, Senator. Appreciate it very much. And of course, Adam Troop is with us as well, who is the CEO of the Utah Association of Counties, who's been very active in trying to pursue this. The news on November 1st in all the newspapers was Utah got it. They got a $70 million Medicaid waiver. What does that mean?
Well, two things really, and I'll let Dr. Shiozawa explain more of the detail on what's in the waiver. But what we've asked for, what Utah asked for, was an exception or a waiver to the rules that govern Medicaid. And that was intended to expand our coverage of Medicaid, but only in a targeted way. And the targeted way was intended to address substance use disorder and people who needed treatment, people with a mental health disorder who needed treatment, and who were somehow involved in the justice system. So you referenced Rio Grande, but in fact it was for a broader population of people, and that is all those people who have involvement in the criminal justice system, which is somehow caused by, related to, or involving their substance abuse problems or their mental health problems. And that's what we're trying to really target in terms of treatment and in terms of a response that addresses those needs.
No, a Medicaid waiver in Utah is not necessarily new. If people look, you'll see a whole list of different areas where they've already given us waivers, like brain injury, intellectual disability, things of that nature. How different is this one, Dr. Shiozawa?
Well, this is quite a bit different in that it is specifically targeted to a population in general, just like Mr. Troop has already alluded to. We're targeting, and in a very timely fashion, those people who with homelessness have substance abuse and who have problems with mental health disorders and are in fact in the justice system. And so it has far-reaching ramifications in terms of not only their health, but also the surrounding citizens. And it's also going to be a template for other, basically, states around the country to look at as they address this. What you say is precisely right, though. Medicaid is one of those big government programs that is federally funded through and administered through the Department of CMS, Health and Human Services, that has specific rules set down in federal doctrine. And then in order for a state like Utah to get a change in what is prescribed across the country, we have to apply for a specific waiver that enables us to adapt to the Utah way, a specific request that brings in federal dollars to help us help our citizens in a unique way. Now, whether it's a brain injury waiver or whether it's a more expansive waiver like the Rio Grande waiver.
Very briefly, there's a cap on it. And yet, if you look at Medicaid, it just says we will treat anything on a 30-70 split. So how do you end up having a, quote, it's understood being a cap, and yet you have a process that says we'll match anything 30-70?
Well, let me answer that in part, and there's two ways to do it. One, you do get a waiver to the requirement to serve anyone who comes in, but who comes in and is eligible. But the other aspect of it is that states have to match the payments that come from the federal government. So the 30-70 requirement is that the state has to pay 30% of the bill, and then they get 70% of the whole back. So they give 30 cents, they get 70 cents, that totals the whole dollar. The state of Utah has said this is the level we will go to, but the level that they've gone to, if I'm not mistaken, said the top would be $30 million of our contribution. That's a big commitment, and it's a good return, but it's a big dollar commitment, no doubt about it.
So that ends up being $100 million towards addressing this problem in total?
That'd be the total overall benefit to the state.
Wow. I'd like to try and figure out exactly how you guys envision that coming into play and how that would work when we get back. We'll be right back after this break on the County Seat.
What would you do with an extra day in Utah Valley? Explore the Wasatch Mountains? Snap a family photo at Bridal Veil Falls. Cool off on Utah Lake or the Provo River. No matter what you're searching for, you can find it in Utah Valley. Bring everyone together.
In a place that is beyond words, there is nothing to be said, except take your time in Bryce Canyon country.
All local products have a story of magical places, real people, and delicious recipes spanning generations. So go ahead and discover flavors you've never tasted and friends you never knew you had. Utah's own Discover Local Food.
Welcome back to the county seat. We are discussing Medicaid expansion and a waiver that the state got last month for $70 million of federal matching money to our $30 million to treat the, quote, Rio Grande problem. We'll continue that conversation. As I was reading through what was entailed in this waiver and what it said it would cover, I was surprised. There were a lot of things I would not have anticipated being a coverable Medicaid expense. How broad is this, Dr. Shizawa?
It's broad in the sense that it is directed to a specific population. When we think of Medicaid, in one sense we say, well, it's going to help those people who are poor, like say a woman who is pregnant or someone who has children, and they can just get general coverage. But what this waiver does is specifically focused on a specific population, those people who are in the homeless situation, who have drug problems, who have mental health problems, and who have problems with the justice system. And so when they're involved in that, whether it's through the judicial system, the mental health courts, or how they find their way into that particular category, then these dollars then are focused to specific treatments to help them. Let's say consider like substance abuse, maybe putting them into either outpatient or inpatient treatment programs. The residential treatment program, Odyssey House and other groups are now going to get funding for many, many beds that they didn't have before to bring these patients in so they don't go directly from the jail back onto the street or from mental health courts out into some hotel with an ankle bracelet, but rather into a treatment program that can give them not only treatment, whether it's physical treatment, medical assisted treatment, counseling, and then also getting them back into better health and maybe even into a job. So really stabilizing care.
It talked about residential treatment beds and jail beds and making sure that there are expanded or capable facilities within the jail. And I noticed even some kind of elements of police training. So how does that kind of fit into that mix? Are they all crucial elements to make this work?
It's going to be hard to have this program succeed, first of all, until we know really how it's going to work. But without enforcement down in, say, downtown, the Rio Grande area to protect not only those people who are homeless, but the citizens around them, and to prevent that vulnerable population from being preyed upon by the drug dealers, we're going to have more police. And then for those people who really are drug abusers or who have violated the law, then they have to go in to jail. And then we have to have, under the JRI, for example, the Justice Reinvestment Initiative, we have to have funding for that, which we didn't get before because we never expanded Medicaid. and then to get them from there into residential treatment or outpatient treatment into programs. All three of these various factors are important. So when you look at the judicial system, what's it supposed to accomplish? Well, public safety, right? Accountability.
Yes.
And rehabilitation. And if you take away one of those three aspects, you're going to have a failure in that system. And we have to have that rehabilitation. We've been pretty good with accountability, and we're pretty good with public safety. Now let's get into the rehabilitation portion.
What has changed? I mean, originally at the time that Representative Hutchings put JRI out, and I remember him telling me it out on the plaza of the Capitol, says, you know, this thing, if we get the governor's healthy initiative through and get it funded, which he thought was going to happen, he said, it'll have the money it needs. And I said, so what if it doesn't? And he said, well, I've got a few $1 million squirreled away for this. And I said, because that's the big concern of the counties, is it won't have enough money. What has changed in that environment with the legislature about making these commitments? Because they didn't want to get on the hook before.
Sometimes it just takes time for all of the legislature to see a problem and appreciate it. And maybe Rio Grande had to come forward and come to a head so that finally it convinced all of the legislators that, you know, we really do have a problem. We are desperate. We're seeing problems. Murders, for example, increasing population, emergency departments, jails flooded with patients. And oh, by the way, since we didn't fund the JRI and the nonviolent offenders were not in jail and we didn't have the beds funded for them there, where did they go? Well, they went on to the streets. And so we had the worst of both situations. We weren't incarcerating those that really should have been incarcerated. We weren't treating them. And so the problem just got worse and worse because we failed to take that next vital step, which was funding.
And I join in that assessment too. It's the idea of people coming to see what is going on in reality, what's going on in their communities, and not people saying, hey, we've got to address this beforehand. I think it takes time for everybody to take a look at what was done and then what the impacts were. And when you find that, then you do work on developing alternative solutions. And I think the legislature has done a good job of getting this far. Again, it's a big chunk of money to put into this. And I think the next step is going to be, does it help public safety? Does it help the communities? And if it does, we're on the right track. We can keep going. And I think that's a real positive. We'll just have to see how it develops and how people get the work done.
Now we're going to dive into some of the details here in just a second. We'll be back with the county seat as we continue our conversation on Medicaid expansion.
There is a place where looking out means looking in, where an impression lasting only a few seconds will be imprinted on a life forever, where courage is forged and innocence rediscovered, where remembering is rewarding and forgetting unforgettable. There is a place where truth is felt and where seeing is believing. There is a place.
Look south to adventure. Look south to beauty. Look south to San Juan County. Out here, the road goes on forever, and what you'll find will change how you see the world. Climb on your OHV and discover forgotten landscapes and vistas that challenge the imagination. From Blanding and Monticello to the cliff faces of Monument Valley, we're open and ready for you to explore. San Juan County, Utah's Canyon Country.
It's one more, here we go again. I tell myself I'm not in love, but one more time is not enough. One last kiss and then you were gone, and I'm here wishing you could stay a little longer. Stay a little longer. Wishing you could stay a little longer.
Welcome back to the county seat. We are discussing the $70 million waiver, Medicaid expansion here in Utah, specifically for the Rio Grande problem. We ended the last segment talking about the fact that Utah had changed, the legislature, our governing officials had kind of changed their perspective on how they saw this. So my question is there a change in Washington as well? Because we had to go back before for a waiver, and we've gone back this time for a waiver. How is that trip different?
Well, I'll tell you from the outside, it appears to be primarily different because we got an answer a lot sooner than we did with the last administration. I'm not certain why, but I know the senator was involved in some of those discussions, so it may be he can give some enlightenment. But it sounds to me as though there's an approach to providing states more flexibility in how they address their issues and how they deal with federal programs and federal funds. So maybe you can speak to that more.
What was that experience like, Senator?
When I had an opportunity a few months ago to meet with officials from CMS HHS on this particular waiver, one of the questions we asked them is, what is the process that you're taking to evaluate our waiver to make sure it's a valid waiver, and how long is it going to take? Because we have really a desperate need for federal funds, our tax dollars, by the way, to bring back to Utah and help this particular population. And for the first time, under this administration, we heard the words, we want to be customer friendly. How can we help you? Now, when I had gone back before and spoken with the secretary under the Obama administration, it was basically, this is Medicaid expansion, take it or leave it. There is no wiggle room here in terms of adaptation to Healthy Utah or anything else. And now there's many waivers being offered to CMS, and they're favorably looking at them, and what they're trying to do is to say, let's give states the opportunity to experiment, to develop programs, and then let's take those results and come up with something good. That's why this Rio Grande is so important, is that we've been given federal money, but not only federal money, but federal attention. They're watching to see how successful we are and what we can do to then use that in other states.
We have been contributing towards a Medicaid program since the Affordable Care Act went in, and we haven't really taken those monies back out because we didn't want to do the Medicaid expansion. How much money, how big is our credit account back there?
Well, that will vary, but let's just look at the past 2 years, for example.
Okay.
If we say that as a state we pay $600 to $800 million in taxes in various forms, whether it's the medical device tax, the Cadillac tax on Medicare taxes, whatever, we pay hundreds of millions of dollars back to the federal government, much which we could have gotten back. Conservative estimate over the past 2 to 3 years, $1.2 billion that we could have gotten back to the state of Utah in terms of federal funding, had we gone with a fuller expansion.
Wow. So I guess nobody really should complain about $70 million.
Well, not when it's really recapturing some of our own tax dollars. Yeah. And that's exactly the point, is if we Utahns, taxpayers, are going to pay this money back to the federal government, then let's reclaim it, use it intelligently, the Utah way, to help our people create high-quality jobs. We projected we could create thousands of good, high-quality jobs, increase access points, keep people out of the ER, and improve their quality if we did this right.
The translation from somebody homeless seeking care going through this program, how does that translate to the number of visits in the ER? Is there a close correlation between indigent people and medical treatment through an ER?
Unfortunately, when you come to an ER, it ought to be for an emergency, whether you're critically ill or critically injured. But a lot of people come to the ER because they have no insurance and they can't get into a private office or into an urgent care, or because they have simply no other place to go and it's convenient and they can. And so what ERs do is, since we're mandated by the federal government under rules, under EMTALA, to take all comers, then we'll treat them, stabilize them, but the cost will be shifted to each of us who do have health insurance, and you'll cost shift and you'll end up paying for that as well. Now, what's the correlation there? Well, you know that if you get into medical bankruptcy, and what's the number one cause of bankruptcy in this state?
Medical bills.
Medical bills. The ER is a huge contributor. It's 10 times at least more expensive for the similar treatment to be done in an ER versus, say, an urgent care or a family practice office.
You declare bankruptcy because of medical bills, you end up being without work and homeless, and then you end up back in the ER for treatment. I mean, there's a dichotomy there that's kind of an interesting dichotomy.
So one of the other pieces to that is if you are an individual with mental illness, or if you've got substance use problems and you come into the ER, you get yourself through that process, so you've dealt with your emergency situation or your illness for that period of time, you're going to go out back into the community that you were already part of, and you don't have follow-up, you don't have any sort of wraparound services to help. So the fact that you get your sores on your leg treated, or that you get some other medical malady taken care of in the emergency department, doesn't mean you're going to have the opportunity to go back to any other follow-up doctor unless you come back to the emergency room. And are you likely to do that again? No, because we all know that it's hard to get in, it's high cost, et cetera. So what gets treated doesn't necessarily get cured because you don't have another option as to where to go. This waiver is really intended to address a lot of those parts together, and hope that we can find ways to move people towards recovery and towards getting healthy instead of just getting treated quickly.
Excellent. We're going to take a break here. We'll come back for our final thoughts on the county seat, talking about Medicaid expansion and our $70 million waiver. We'll be right back.
There's a little place on a Utah map where I was raised, where my heart's at, where the sagebrush grows wild and high, and the stars come out at night. Oh, there ain't nothing like being raised in the basin with a Ute reservation, skiing starvation, that Duchesne County life.
The Utah Farm Bureau began as a collection of farmers supporting each other to raise the food we enjoy. Today, Farm Bureau membership encompasses everyone, whether ranchers, growers, or just everyday folks like you and me. Members enjoy discounts on items like vehicles and ATVs, or insurance that's very affordable. You don't have to be a farmer to join, and dues are small, but together we make a big difference in keeping our food supply local and abundant. Join Utah Farm Bureau.
Hills Mall offers more than just shopping. Bring the whole family and enjoy SeaQuest Interactive Aquarium to feed the fish and exotic birds, hold live reptiles, and even swim with the stingrays. Or pump up the action and visit Dartside, Utah's premier soft foam dart tag arena. And don't forget the Great Room Escape, where you can challenge your friends to solving mysteries inside themed rooms. So come and experience great fun at the Layton Hills Mall and visit playindavis.com for other great activities.
Welcome back to the county seat. We're talking about Medicaid expansion and the waiver that has just been put in place for opioid, drug abuse, mental health in the homeless population. You know, you ended up with a comment that I thought was very interesting. They're giving us a check and a chance to see what we can do with it and how good of stewards we are. So, Senator, what to you does a good report card look like?
When we look at quality and outcomes, that's going to be my metric as I look for success if I were looking at this. Are we able to impact patients in a positive way? Are we able to demonstrate quality with our programs and efficient use of the healthcare dollars that we're using on those patients? In other words, can we take this patient population and make them better with the amount of money that we've been given? And then take those same processes and work on them, refine them, and improve them.
This is $100 million. Are we going to recoup $100 million if we say can fix, I don't know to say cure or what, if we can take 70% of the lives that are caught in this cycle, this trap homelessness and drug abuse and mental health, if we can fix 70% of them, is it worth $100 million?
Absolutely. If we could help 70% of those patients, I would take that data and publish that nationally and use that as a national template for success. That would be so good to help that many people. Because if you put a dollar sign on that, think of the people who would be free of drug abuse, into productive lives, more stable relationships with their families, their children off the streets and healthier, and our jails and our streets safer. How much would you pay for that? All for that small investment.
You think? Yeah, go ahead.
I'd just add to that, if you think about the impact on the criminal justice system of addressing mental health problems, addressing substance use problems, and you look at what the impact is of making those changes and making even a 50% change in those numbers, it would be huge. Well over 50% of the people who go to jail or go to prison have a substance abuse history or a mental health history that's typically untreated. If you lower those numbers, you lower the cost for corrections, you lower the cost for law enforcement, you lower the cost on victims of crime. And that really is where this is the biggest issue.
Knowing that our nation's chief executive is a bottom line kind of guy, you think this would demonstrate an actual return on investment, that the savings from the changed lives would contribute more than the $100 million it took to get them there?
If we could demonstrate 50 or 70% improvement in these people's lives, I think that would be a huge return on investment, not only to the patients, but to all their families and to us as people who are trying to lead this country and look at it in a very positive way.
Okay, you guys got the green light for this 35 days ago, 36 days ago. How long is it going to take before this is actually on the ground and things are starting?
Well, things are starting because this has been a process that's been going for several years. The question of how soon is that money from the federal government going to get into hands of local providers and local organizations, I can't tell you that for certain, but it will happen relatively quickly. We have the waiver to go forward. We have to have it, everything finalized by the State Department of Health so we can start billing for that. But we already have people lined up ready to bill and to move forward. But the reason it's already underway is that this is an approach that the counties have been taking to move forward on treatment, that law enforcement's been taking, that the legislature and the executive branch have been pushing counties on to say, come up with new ideas, find alternatives to incarceration, let's get people out of emergency rooms and into other treatment options. So the process is moving forward. But it's sort of like turning an ocean liner. It doesn't happen quickly. We've got to keep moving. We've got to keep going the right direction. And if you go the wrong direction, you end up having to change your course again and get on the right path.
Well, hopefully we are on the right path. Gentlemen, thank you so much. It was a great conversation. Thank you for watching The County Seat. We appreciate your participation. Please like us on social media and share this with your friends. It's a great way to get additional news updates as they happen with County Seat Live. So like us on Facebook, and we'll see you next week on The County Seat.